According to the Rare Disease Act of the Philippines, rare diseases are those affecting no more than 1 in 20,000 individuals in the country and recognized as such by the Department of Health upon recommendation of the National Institutes of Health. For today's show, we will be talking about the most common rare disease in the Philippines, maple syrup urine disease or MSUD. To answer questions about this disease, we'll be joined today by Dr. Dave. Good morning, Doc.
Good morning, Yule. Hello and good morning to our viewers today.
So, can you tell me and all of our viewers, what is this MSUD?
Maple syrup urine disease or MSUD is a rare autosomal recessive disorder that affects an estimated 1 in 185,000 infants worldwide. In the Philippines, 1 out of 65,953 live births are diagnosed with MSUD as of December 2019. The Metabolic Registry at the Institute of Human Genetics currently lists 195 patients diagnosed from 1990 to 2017, making it the most common inherited metabolic disease in the country.
Wow, it is no wonder not too many people know about this disease, Doc. But how does having this rare maple syrup urine disease affect patients?
There are 5 types of MSUD depending on the genes that it affects. They can be classified as classical, intermediate, intermittent, thiamine responsive, or E3 deficient. Generally, the presentation of MSUD starts with nonspecific symptoms of increasing neurological dysfunction followed by focal neurological signs. If left untreated, progressive brain damage is inevitable and death occurs within weeks or months. One distinct finding in MSUD and the reason why it's called maple syrup urine disease is the development of an odor reminiscent of maple syrup that can be most readily be detected in the urine and earwax.
So, Doc Dave, what causes MSUD?
MSUD is an inherited metabolic disorder involving a group of branched-chain amino acids or BCAAs, namely leucine, isoleucine, and valine. Normally, these amino acids are metabolized by a number of enzymes. In MSUD, however, there is a deficiency of one of these enzymes called the branched-chain alpha-ketoacid dehydrogenase or BCKAD enzyme complex. The change in this complex is caused by the mutations of the genes encoding for it. It catalyzes the decarboxylation of the alpha-keto acids of the BCAAs to their respective branched-chain acyl-CoAs. The decrease in BCKAD activity therefore prevents the normal breakdown or catabolism of the BCAAs, which causes the accumulation of these amino acids and their byproducts in the body, particularly in the blood, spinal fluid, or saliva.
It is unbelievable how a few genes can cause such a change in the normal body function. Doc Dave, how does the accumulation of those substances cause the signs and symptoms you mentioned earlier?
Basically, all of these symptoms result from the accumulation of BCAAs. The distinct maple syrup or burnt sugar smell is due to the accumulation of isoleucine in the urine. Leucine, on the other hand, is the one responsible for the neurological manifestations. It is transported to the brain and is metabolized into glutamine and glutamate. This then increases the glutamate levels, which affect significant brain development and cognitive functions such as memory and learning. Furthermore, leucine accumulation affects water homeostasis within the subcortical gray matter. This causes swelling within the brain and alters nitrogen homeostasis. The increased nitrogen levels can therefore increase the ammonia molecules, which is a neurotoxin. Ammonia enters the brain and is incorporated into glutamate, forming glutamine. This eventually affects glutaminergic neurons, which are responsible for the mediation of vital processes such as formation and retrieval of memories, encoding of information, spatial recognition, and maintenance of consciousness. Excessive excitation of these receptors has also been associated with hypoxic injury, hypotonia, and convulsions. Lastly, leucine can compete with other important amino acids in the CNS such as tyrosine, which is involved in protein signaling and the production of 3 of the major brain neurotransmitters, epinephrine, norepinephrine, and dopamine.
So, for the parents and the parents-to-be tuning in, are there ways to check if their child has this disease like maple syrup urine disease or other rare diseases?
One thing about this disease, Yule, is that infants with maple syrup urine disease appear normal at birth. Thus, parents may not notice anything out of ordinary at all at first. So yung parents na viewers natin ngayon, hindi nila yung mapapansin agad-agad. Furthermore, the smell of maple syrup usually is not present until symptoms develop. However, within the first week of life, the symptoms may start to show like decreased feeding, vomiting, poor weight gain, increasing weakness, seizures, and the characteristic maple syrup smell of the urine. It should be noted, however, that not 100% of the babies who have sweet maple syrup smell have MSUD. This characteristic urine odor has also been reported in healthy infants not affected with MSUD. The reason for this is not yet understood. So, wala pa tayong gaano study about it.
So it seems that we can't fully rely on the symptoms to know whether someone has MSUD.
That's true, Yule. There are cases such as in infants with non-classic MSUD, for example, the intermediate and the intermittent type, where the patient's symptoms may be milder. In these cases, the parents may not notice warning signs until their children are 12 to 24 months of age, and these are usually in response to illness or increase in protein intake. But by this time, metabolic decompensation can already occur. There may already be ongoing effects to the nervous system causing weakness, seizures, and even coma. Unfortunately, with no immediate treatment, patients have died during these sudden episodes.
Is there any way we can find out if a child has MSUD way before all these complications do any harm?
You know, Yule and our dear viewers, today we are very fortunate that tests for MSUD are now available to families as part of the newborn screening program of the Department of Health. The blood specimen is sent to the newborn screening center and the test is performed within 24 to 48 hours following birth. Molecular genetic testing for mutations is also available to confirm the diagnosis. These tests are necessary for carrier testing and guide prenatal diagnosis for at-risk pregnancies.
That is good to know, Doc. It really helps to know and be prepared. Para naman maalagaan natin yung kalusugan ng mga bata, di ba? Tama naman, di ba, Doc?
That's right, Yul. With all the advances in medicine, we get to understand more and more of all these conditions, even rare ones such as MSUD. Alam mo, mahirap talagang magkasakit sa panahon ngayon, lalo na tong mga rare diseases natin. And as a parent, to discover that your child has, say, a rare condition like MSUD, malaking bagay yun. But that's the point, right? To know, as you have already said, Yul, so we can all better care for our children. With early diagnosis and appropriate treatment, our children can live life to the fullest.
There's always hope, Doc. What can families expect about the treatment options available for their loved ones with MSUD?
Currently, there are two main approaches to treatment. First is the long-term daily dietary management, and the second is the treatment of episodes of acute metabolic decompensation. The mainstay in the treatment of MSUD is the BCAA intake restriction. If you remember, the unbalanced BCAA level is the main culprit and the excess production of toxic byproducts is too much for the body to handle. We cannot just remove these proteins from the diet as they are needed by the body. And that's why it is only by consulting with a neonatal or pediatric nutritionist with expertise in dietary management of metabolic disorders can we address this immediately. However, the risk for metabolic crisis still remains even if affected individuals strictly follow the specialized diet. Episodes of metabolic crisis require aggressive and immediate medical intervention. This means that any method that increases calorie uptake and reduces protein breakdown may be helpful, such as administration of glucose insulin drip and intravenous fat, respectively. Providing all the other amino acids in sufficient amounts is also essential to permit new protein synthesis. Aside from those, there is this promising investigational therapy of liver transplantation for curing patients with classical MSUD. There have already been reports of individuals being symptom-free and able to eat normal foods after the operation.
For those that undergo liver transplantation, success rates are actually very high. Still, the availability of the donor and the high cost of surgery are the hardest obstacles to this procedure, especially in the Philippines. So, para malabanan natin itong MSUD, we need to slow down its progression until na di na natin kailangan ng liver transplantation. Early diagnosis is always our priority. You see, MSUD is an orphan disease, meaning very few institutions are finding ways to treat it. That's why we need more people to be aware about such diseases, because this means more research which lead to more effective ways of managing them.
So early diagnosis and awareness is the key. Thank you so much, Doc Dave, for being with us today, and I hope our viewers learned very much about MSUD and the importance of learning about these rare diseases and the role of newborn screening in managing these diseases. Stay safe, everyone, and remember to care for rare. To learn more about orphan diseases and how you can help, visit the National Organization for Rare Diseases website, rarediseases.org, and the Philippine Society for Orphan Disorders, psod.org.ph.